my name is Genesis. I'll be your nurse today. Can I get your name and your date of birth?
Hello, my name is Nicole Priest. My date of birth is August 28, 2003.
What brings you in today?
Just for physical.
Okay. Do you have any relevant past medical history?
I don't think so, no.
Okay. Here is when I would ask about the last menstrual period, gestational pregnancies, any children, anything that would be relating to a woman. Okay, so to start, I'm just gonna have a look at your head, make sure there's nothing abnormal, no bumps, lesions, looks good. Now I'm gonna do a cranial nerve assessment. So I'm just gonna have you look at my nose and just keep looking at my nose. Okay. And now I'm just gonna have you follow the pen. That way I tested that her pupils are equal, round, reactive to light, and have the ability to focus. Now I'm going to feel your lymph nodes right here, okay? And just here. Everything looks good. I'm gonna feel your thyroid from behind. Can you swallow for me? Feels good. I don't feel any enlargement of the thyroid, and there's no tenderness on the lymph nodes. And do you have any trouble hearing?
No.
I'm just gonna do a test for hearing. You can close your eyes and tell me which side you hear the noise on. Oh, okay. Now I will listen to your lung sounds from the back. Deep breath in. Sounds normal, and I made sure to go from side to side and not up and down. Now I'm just gonna take a listen at your heart. Okay, sounds good. And do you ever feel any shortness of breath, chest pains, fatigue,
No.
dizziness? Okay. Now I'm just gonna check the radial pulse to make sure it's consistent with my findings. Looks good, feels good. I'm gonna do a strength test on your upper body now. So you could just squeeze my fingers as hard as you can. Good. Now resist when I try to push down. Good. And I'm gonna have you lay down now so I can listen to your belly. Do you ever have any trouble using the bathroom or abdominal pain?
No.
Okay. I'm gonna listen to the lower left quadrant, then the upper left quadrant, the right upper quadrant, and then the right lower quadrant. And are you experiencing any pain right now?
No.
Okay, if they were, then I would palpate and auscultate. You can sit back up now. I'm gonna raise the bed so I can check your reflexes. I'm just gonna check the reflexes of your knees. Good job. Good. And now I'm gonna try and push, and you're gonna try and push my way. Ready? Good. This one. And now the opposite way. Good. Good. And I'm gonna look for your pedal pulse. Feels good. And do you have any issues with gait or mobility?
No.
Okay. The skin looks intact while I was performing my assessment. Skin tone is regular. There are no lesions or wounds. And that is all.
May I come in? Mm-hmm. Hello, my name is Sarah. I'm going to be your student nurse today. Could I get your first and last name and date of birth?
It's Millie Larson, and it's 9/14/1949.
Awesome. I'm just going to check that against your wristband here. Looks good. Do you have any allergies, Millie?
No.
Awesome. And your chart is the same thing. All right, what brings you in today?
So I was gardening, and I tripped over a tree stump in my garden, and I hurt my right ankle.
Okay, and you said it was your right ankle?
Mm-hmm.
Okay, and what does the pain feel like if you had to characterize it?
It's kind of a dull, achy pain.
Okay, and does that stay in that area?
Mm-hmm.
Okay. All right, and then if you had to rate the pain, how would you rate it? 0 being no pain to 10 being the worst pain imaginable.
I would say it's a 3.
Okay. All right, and is there anything that makes the pain better for you?
Just sitting down makes it better.
Okay, and is there anything that makes it worse?
I would say walking makes it a little bit worse.
Okay. Is the pain tolerable for you?
Mm-hmm.
Okay, well we can see if we can make it any better for you today, okay?
Okay.
All right, I'm gonna go ahead and throw some gloves on. And then I just have a couple of questions for you before we start your head to toe assessment. Now the head to toe assessment is just gonna be an assessment from your head all the way down to your toes. And if you have any trouble with your ankle or any kind of pain throughout the assessment, let me know and we can take a break and assess that pain, okay?
Okay.
All right, so just a couple questions for you. Do you know where you are right now?
Concordia Hospital.
Okay, and do you know what day of the week it is?
It's Tuesday.
All right, and who is the current president of the United States?
It's Joe Biden.
Okay, you are conscious, alert, and oriented ×4. No abnormalities in your speech and no involuntary movements. So I'm going to get started on your head to toe by starting at the back of your head here at your scalp. Looks like no signs of skin breakdown, no signs of alopecia. I'm going to check for some pressure ulcers while I'm back here. No signs of pressure ulcers. I'm going to check your coccyx. No signs of pressure ulcers there either. I'm going to go ahead and get started on your ears. Do you wear hearing aids?
No.
Okay. I'm going to check behind your ear. No signs of skin breakdown. Check in your ear. No signs of excess cerumen. The other ear. No signs of skin breakdown. Checking inside and no signs of excess cerumen. While I'm here, I'm just going to check your temperature. Skin is warm to the touch. Color is normal for ethnicity. And then I do see in your chart that they took your temperature at 98.8 and your oxygen saturation is 97% on room air. I'm going to go ahead and check your temporal pulses. Temporal pulses are equal to plus bilateral and regular. I'm going to go ahead and check your eyes now. I'm just going to have you follow the pen with your eyes. Try not to move your head, okay?
Okay.
Good. And then I'm going to go ahead and check your pupils. If you could just look at the wall behind me. And I will be checking your pupil size. Good. Your pupils are 4 millimeters, equal, round, reactive to light, and accommodating. I'm going to go ahead and check your sclera here. Looks like your sclera is white, no signs of jaundice. I'm going to check your conjunctiva. Okay, your conjunctiva is pink and moist. I'm going to move on to your nose now. Upon looking at your nose, there are no signs of skin breakdown. I'm going to look inside. If you could just look up for me. No signs of nasal polyps, and your skin is, or your mucosa is pink and moist. I'm going to go ahead and move on to your mouth now. Do you wear any dentures?
Mm-mm.
Okay. If you could open up and stick your tongue out for me. Your mucosa is pink and moist, and then your tongue has no signs of thrush and is symmetrical. Do you wear any glasses, by the way?
No.
Okay, awesome, thank you. We're gonna move on to your throat. Do you have any trouble swallowing?
No.
Okay, go ahead and swallow for me. Awesome, no signs of tracheal deviation. Do you have any excess coughing,
No.
excess sputum?
Mm-mm.
Okay. All right, I'm gonna check your carotid pulse here. Alrighty, your carotid pulse is equal to plus bilateral and regular. I'm going to check for skin tenting. Alright, no signs of skin tenting, no dehydration. I'm going to go ahead and check your brachial pulses now. Just be checking right here. Brachial pulse is equal to plus bilateral and regular. I'm going to check your radial pulse. Radial pulse is equal to plus bilateral and regular. I'm going to be checking the sensation on your arms. Let me know if you feel this equally.
Mm-hmm.
You do? Okay, awesome. Sensation is equal and present on both arms bilaterally. I'm going to go ahead and check your capillary refill. Capillary refill is less than 2 seconds on all 10 digits of the upper extremities. I'm going to have you show me your elbows really quickly. No signs of skin breakdown on the elbows, and then we're going to do some strength. So if I could have you just pinch my fingers and then pull my hands towards you and push my hands away. Awesome. So strength is a 5 out of 5 on the upper extremities. We're just going to do a little bit of range of motion. If I could just have you put your arms at your side, lift them all the way up and back down. Then I'll have you go forward and back down. Full range of motion on the upper extremities. And on your arms, your skin is normal for ethnicity as well. We're going to move on to the lung assessment now. So I'm just going to be monitoring the rise and fall of your chest. If you could just take a deep breath in and breathe out. Chest rise is equal on the anterior and posterior sides. I'm going to check your chest rise right here. Go ahead and take a deep breath in and out. Chest rise is equal and symmetrical on the anterior side as well. Okay, so I'm going to be checking your lung sounds. I'm just going to be moving my stethoscope across your chest and back. Each time I move it, you can just take a deep breath in and breathe out. If you have any trouble breathing throughout this part of the assessment, let me know and we can take a break, okay?
Okay.
Breathe in and breathe out. 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 All right, lungs are clear to auscultate on the anterior side. No adventitious sounds are noted. I'm going to move on to your back side here. If you could just breathe in for me and breathe out. Breathe in 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 and breathe out. Good. All right, lungs are clear to auscultate on the posterior side. No adventitious sounds were noted. You doing okay, Millie?
Mm-hmm.
Okay, awesome. We're going to move on to the heart sounds now. So I'm just going to be moving my stethoscope again. However, this time you don't have to breathe abnormally. You can just continue normal breathing, okay?
Okay.
Towards the end of it, I will be stopping at your apical pulse to check your heart rate. Nothing's wrong, just we'll be checking your heart rate for a minute. And your apical pulse is located at your left midclavicular line between your 4th and 5th intercostal space.
Okay.
Aortic area. Pulmonic area. Herb's point. Tricuspid area. Mitral area. All right, so S1 and S2 were present. The rhythm was regular, and your heart rate is 82 beats per minute. And then I did stay an extra 30 seconds to check your respiratory rate, which was 18 breaths per minute. Okay.
Okay.
Alrighty. So we are going to move on to a couple of questions for you about your diet and your poop and peeing habits. Okay.
Okay.
All right. To start off, what do you eat on a daily basis?
I typically eat 3 meals a day, and I try to have vegetables and protein at every meal.
Okay, awesome. Keep that up. And then for your water intake, how much water do you typically drink?
I typically drink 5 cups a day.
5 cups. Okay. So the recommended amount is 8 cups. If you could just drink a little bit more water. If you don't like the flavor of water, you can always go to the store and get those flavor additives. You just add it to your water. It makes it taste pretty good.
Okay.
Okay, and then for your bowel movements, when was your last bowel movement?
This morning.
This morning, okay. And then could you describe that bowel movement to me?
It was brown, and it was fully intact, I would say, not too runny and not too hard or anything like that.
Okay.
Yeah.
All right, and then what is your bowel movement pattern? How many times do you typically go? A day, a week?
Probably once a day.
Once a day, okay. All right, that is normal. And then for peeing, how many times do you typically pee a day?
Probably 3 to 4 times.
3 to 4 times, okay. And then do you have any trouble getting to the bathroom?
No.
Okay, and now when you're going to the bathroom, do you have any trouble peeing?
No.
Okay, are there any abnormal odors or scents?
No.
No? Okay. And then do you have to pee right now?
No.
We're gonna go ahead and get started on the abdomen assessment. If I could just have you lie back on the bench here, and I'm gonna pull this out. You can go ahead and rest your legs down. I'm gonna pull up your shirt just a little bit here. Okay. Upon inspection of the abdomen is non-distended. The bladder is non-distended as well, and there are no signs of bulges or masses. So I'm just going to start by listening to your bowel sounds in each of the 4 quadrants of your abdomen. And I'm going to start with the right lower quadrant, right upper quadrant, left upper quadrant, and the left lower quadrant. Alrighty, your bowel sounds are normoactive and present. I'm gonna go ahead and start palpating your abdomen. I'll just be using light pressure at first, okay?
Okay.
Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and the bladder. Alrighty, upon light palpation, there was no tenderness and no enlarged organs or masses noted. I'm gonna go ahead with deep palpation now. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and the bladder. So upon deep palpation of your abdomen, there were it was non-tender, and there were no signs of enlarged organs or masses as well, and your bladder was non-distended.
Okay.
So that is it for the abdomen assessment. I'll go ahead and pull this in for you. I'm just going to move on to some strength exercises on your legs. If you could just go ahead and push up against my hands. All right, and then I'm going to check your popliteal pulse while I'm here. Okay, the pulse is weak. I'm going to go ahead and check your other pulses as well.
Okay.
So starting back here, I have your posterior tibialis. Posterior tibialis is equal to plus bilateral and regular. I'm going to check your dorsalis pedis pulse. Dorsalis pedis is equal to plus bilateral and regular. I'm going to go ahead and assess for edema right here. No signs of pitting edema. It's a 0 on the edema scale, and your skin color is normal for ethnicity. I'm going to do the lower extremity strength here as well. If you could just push down on my hands and pull up on my hands. Awesome. Strength is a 5 out of 5 on the lower extremities. I'm going to go ahead and do your capillary refill here. Capillary refill is less than 2 seconds on all 10 digits of the lower extremities. And then we are going to move on to some gait and range of motion. Just going to change my gloves really quickly. Are you doing okay, Millie? Okay. So do you have any questions for me so far?
No.
So I'm going to help you off of the exam table here. Go ahead and take a step down, and I'm going to have you walk to the door and back, please. All right, posture is erect, gait is steady with slight guarding in the right ankle where your injury is. Now we're going to do some range of motion. If I could just have you take a bow forward and back up. Awesome. And then I'm going to have you hold on to the exam table here. You're going to kick up, bend the leg, and kick all the way back behind you. And same with your right leg, kick up, bend your leg, and kick all the way back behind you. All right, you have full range of motion in your lower extremities, and that concludes our head to toe assessment today. I do see that the doctor prescribed you 400 milligrams of ibuprofen. Just make sure that you are taking that with food and a full glass of water to avoid any kind of tummy upset, okay?
Okay.
And it looks like we'll be seeing you back in 2 weeks. Do you have any questions for me?
No.
Awesome, you have a good rest of your day.
Thank you.
Thank you.